Hello, and welcome to Equipment and Care module of your Instructor Training. Our agenda today will be discussing Manikins, the decontamination and the brands, the AEDs, the pads and the troubleshooting, the student materials for all classes, bag valve mask and pocket mask for CPRO classes. Let's talk about some safety guidelines for Manikin use during classes. Students should not eat or chew gum or drink while using their Manikin. You also want to make sure that the students have gloves on when they're touching our Manikins or touching each other. Each time the student uses the Manikin, they should bring their own face shield or breathing barrier to the Manikin. If students are sharing Manikins, properly decontaminate the Manikin between users, even when breathing barriers are used. Students should not use any Manikins that have cracks or rips in the face. I need you to notify your logistics staff of any equipment problems or issues. Let's talk about decontaminating our Manikins. To protect you and our students, gloves should always be worn when decontaminating and assembling Manikins. Guidance on the decontamination can be found on Instructor's Corner under Additional Resources. Solutions and/or wipes for Manikin decontamination will be provided by the Red Cross. Contact your logistics staff for additional supplies. For most Manikin types, Clorox disinfectant wipes or alcohol, 70% isopropyl alcohol wipes can be used. Decontamination guidelines can be found on your Instructor's Corner. Decontamination after the class. Make sure that you properly decontaminate and store the Manikins after each class. This should be done as soon as possible. Instructors should always dispose of airways and replace airways according to guidelines. Instructors should wipe down the Manikins completely with an approved cleaning solution after class, and you may contact your logistics staff for additional guidance and supplies. Manikins with removable faces. Each student receives their own face. Removable faces are always decontaminated by washing and soaking them in a bleach water or using bleach or alcohol wipes to clean the surface area. We have different types of Manikins. The first picture you'll see is Laerdal. We have the Little Annie, which is the adult Manikin, a Baby Ann, which you'll see in the bag of 4, and we also have some Little Juniors. The Prestan Manikin is the gray Manikin in the middle, and then we have Actars there on the bottom. Laerdal has a separate face for each student with the Little Ann, and it also has a one-way valve that you'll dispose of and replace after each class. Faces are washed and soaked in a bleach solution for 10 minutes, or you need to use Clorox or alcohol wipes. The Baby Anns have a separate face, and individual lung should be used for each student. Decontamination. You'll separate the jaw, the face, and the airway, dispose of the airway, wash the jaw and the face, soaking in a bleach solution for 10 minutes, or use alcohol or Clorox wipes. The Prestan Manikin cannot be shared. A best practice is to assemble these Manikins before the students arrive. Each student has their own Manikin. They change the lungs after each student, and Manikins can be broken down and wiped down after each student at the end of the class with a Clorox or alcohol wipe. Our Actar Manikins cannot be shared as well. A best practice is to assemble them before class. Adult Manikins are decontaminated with Clorox or alcohol wipes. You'll wipe down the chest plates, the head, and the face, and lungs are disposed of after each class. Actar infant heads must be cleaned by washing them and soaking the entire head in a bleach solution. Manikin usage. Class time is based on a 2-to-1 Manikin ratio according to the instructor's manual. Luckily, in our sector, we have enough mannequins that most of the time will have a 1-to-1 ratio. Our AEDs, we have 2 students to each AED. Adult and pediatric pads should be in the AED pouch. You should have extra batteries on hand and make sure you know how to change them. You should use adult AED pads when you're teaching Red Cross skill sessions since we don't simulate pediatric AED skills. AED pads should be reused until they're dirty and have trouble sticking. You will be the judge. Would you use them? Have the students reattach the pads to the white sheet they removed the pads from at the beginning of the segment. AED troubleshooting. All right, most of the AEDs don't work, but that's okay. We have one AED in that bag that is functioning. That's the best practice, because it is for you to hold that AED and have the students follow the directions of that lead AED without them even turning on their AED. And then when it says plug in the connector, have them plug in the connector. You also can watch this training segment on facilitating an AED on the instructor's corner. Babysitting training. All babysitter students should receive a personal protective equipment bag. And all of that stuff should be disposed at the end. Don't reuse anything. We're in flu season. We want to make sure that we're keeping everybody safe, including you. Students should use gloves every time they're touching their mannequin or each other. They should be issued the Babysitter Handbook, the Emergency Reference Guide, and the CD-ROM. And students should keep this material after class. Babysitter tubs with materials and supplies will be provided for each class. Student materials for the first aid CPR AED. All students should receive a package with their PPEs in it. Students should have their gloves on every time when they're touching the mannequin or each other. Make sure you dispose of anything that's left. They receive an adult first aid CPR AED ready reference card that you're going to collect back up at the end, and a pediatric if you're teaching pediatrics. Glove removal. You should teach glove removal when you're teaching blended learning, full courses, or CPRO, and lay responders. You should teach it right before at the scene activity. So when they're doing the at the scene activity, they already know how to put on gloves and take them off. You can find the skill sheet on the instructor's corner. Student materials for the CPRO. Adult and pediatrics masks are required to be given to each student in the CPR for the professional rescuer and the EMR courses. These masks will be taken home by the students. Students should be given a CPR for the professional handbook during the class, but we collect them back up at the end as part of our library stock. This is a bag valve mask. You use it during a CPR for professional rescuer and emergency medical response classes. There's a 2-to-1 ratio with a BVM. Pediatrics and adult BVM should be available for students. If you need additional BVMs, please contact your logistics staff. Thank you for your continued support of the American Red Cross. Thank you.